Welcome back to the show Talk with Your Doc. With us today is Dr. Zaki Ahmed, and we are talking about cardiac arrest. Dr. Zaki, you were mentioning about two different types of cardiac arrest, shockable and non-shockable. So how do you know which is one who gets what type of cardiac arrest?
Yeah, so it's that's a very interesting question. As someone who's actually seeing a cardiac arrest occur, there's no way to tell. So I have over 20 years of experience just dealing with cardiac arrests. And despite that, I can't tell just by looking at someone what kind of rhythm they would have. So it's really, really important to not depend on whether it's shockable or not shockable, but to do everything the same for everyone.
Okay. Now, as you were mentioning that there are various risk factors for the cardiac arrest. Now, who gets the shockable and who gets the non-shockable?
Yeah. So people who usually have heart attacks, they are much more prone to develop rhythm that's called ventricular fibrillation or ventricular tachycardia. Both of those rhythms are shockable rhythms. So majority of the people will have a shockable rhythm because majority of the people will have cardiac arrest secondary to heart attacks.
Okay. Now, so once somebody gets the cardiac arrest, what are the complications? What can happen to that patient?
So when someone has a cardiac arrest or when someone dies, the most important aspect of the body that we worry about is the brain. Circulation to the brain is vital. It is the system in your body that without which you just can't be yourself. And unfortunately, when someone has a cardiac arrest, the first thing that gets compromised is the brain. So within minutes, you can have damage to the brain. And that's one of the reasons why it's really, really important to make sure that we get that circulation going to the brain as fast as we can. It's also very important that there's times when modern medicine is excellent. We're able to bring people back very, very well. We're able to keep their heart going, keep their lungs going. But unfortunately, the brain, we still don't have much that we can do once the damage has occurred. So that's what makes it really important for us to talk to our loved ones, talk to them about our wishes in case we have brain damage and we can't make decisions. Do we want our bodies to keep on going with ventilators and life support machines?
So once somebody gets cardiac arrest and if he is not or she is not revived within certain time frame, what is that time frame to prevent the brain damage?
Minutes. So depending on your circulation, it could be anywhere between 1 and 4 minutes.
So between 1 and 4 minutes, they have to be revived.
Yes.
To prevent the brain damage.
Or at least, even if you can't revive them completely, at least take measures that will help keep the blood flow going to the brain.
Okay. So to prevent this brain damage, what should one do when we see somebody collapsing right in front of our eyes?
So the most effective thing that you can do, and one that requires the least amount of training, is doing CPR or cardiopulmonary resuscitation. Those are the actions that you see a lot of people jumping on the chest and compressing on the chest. That is, it's easily trained. So you can take a half-a-day class, do a one-day class, learn about CPR. Unfortunately, only 30% of the people that people actually see fall and lose consciousness and have a cardiac arrest actually get CPR.
40% only.
30%.
30%.
So only 1 in 3 people that have actually have a witnessed cardiac arrest get CPR. And a lot of that has to do with us not being trained well enough, us as a general population.
So how does the CPR or cardiopulmonary resuscitation work? What is the mechanism?
Yeah, so very good question. So one of the things that the heart does is pumps blood that goes up into the brain, that goes up to the rest of your body. And what CPR is doing, because the heart itself's not pumping, what you're doing is you're compressing the heart so that the blood that's in there will pump over to the vital organs of the body, especially the brain.
Now, only trained people can do CPR, or anybody can do it?
Absolutely not.
Like if I have not taken a CPR class, can I do it?
I think one of the things, ideally you should have a CPR training, but even if you don't, it's been shown that even if you just press on the chest,
keep on pressing.
Just keep pressing on the chest. It's a little bit. So if you take a look at your chest bone, which goes from the top to the bottom, you get right to the bottom. You go a little. You put the bottom of your hand right on the bone, and you just press on the left side of that, and you keep doing that.
How long one should do?
Just keep doing it till the emergency medics get there.
Now, so first thing should be dial 911 and do CPR, or do CPR first and call?
No, absolutely. So dial 911, put them on a speakerphone. Most of our devices now have speakerphones. Put them on the speakerphone and start doing CPR.
CPR, as long as you want to do it.
You keep going till the paramedics get there.
Okay. Is there any alternative method other than the CPR?
So in public places, they have what's called automated electrical defibrillators. Automatic external defibrillators, AEDs. The AEDs are devices that we can use for shocking someone if it is a shockable rhythm. So if you do a CPR course, it's very easy because they teach you how to use these AEDs. They're available in most public places, in our malls, in the gyms, at the airports. So they're available. It's just that someone has to know how to use them. Most of the people in these public places, so the security guards and everyone, have CPR training, so they're able to. But if they don't, it's very important for us to be able to do that as a layperson.
Now, to go to the CPR training, do we need any qualifications or?
Absolutely not. My daughter, my daughter who's 11 years old, she's done her CPR course, and I think it's very important for every one of us to do it.
And where do they get the information about the CPR course?
So there's a few places in Thunder Bay. One of the most popular one is the St. John's Ambulance, and they do CPR. I remember taking a course with St. John's when I was 11, and so they've been around that long, and they do a fantastic job.
So it's a half-day course of CPR, but can save a life of somebody else.
Absolutely, it can save life of a loved one, most importantly, and then including strangers.
We'll take a short break and we'll continue our discussion.
Sounds good.
Please
Thank you.
stay back for the last portion. Thank you.